Hello, everyone, and welcome to the Empowered NYC webinar. Today's webinar is going to be on overview of SSI benefits and work supports. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. If you accidentally close the panel, you can reopen by going to the Communicate menu at the top of your screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer or prefer to listen by phone, dial 1-650-479-3207, event number 669-634-414. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like chat, Q&A, and/or participants. For Q&A, please use the chat box or Q&A box to send any questions you have during the webinar, and we will direct them accordingly during the Q&A portion. If you are listening by phone and not logged into the webinar, you may also ask questions by emailing them to sbrown@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the following website, realeconomicImpact.org/our-work/financial counseling. If you experience any technical difficulties during the webinar, please use the chat box to send a message to Shahida Brown, Project Coordinator, or email her at sbrown@ndi-inc.org. With that, I'm going to turn it over to my colleague, Nancy Bhutto. Nancy?
Hi, everyone. Hi. This is Nancy Bhutto with National Disability Institute. Sorry for that little delay. Before I do partner introductions, I would just like to take a moment and remember the 17th anniversary of 9/11 and remember those that we lost in the terror attacks of September 11th, 2001. Thank you. So we are very happy to have wonderful partners with us today. Wanda Lopez from the New York City Office of Financial Empowerment, Martha Jackson with the Mayor's Office for People with Disabilities, and Frances Liu, who is with City Community Development. A little bit about Empowered NYC. It's a groundbreaking new partnership dedicated to improving the financial stability of New Yorkers with disabilities and their families. The collaboration is an initiative that will create, test, and promote new strategies to enable New Yorkers with disabilities to improve their financial stability. This initiative will advance financial capability through broad engagement and education, tailored one-on-one financial counseling to enhance with new expertise, outreach and tools, and specialized benefit support services. As I mentioned, we have some people with us today. We have numerous strategic partners working on this project, including the New York City Office of Financial Empowerment, the Mayor's Office for People with Disabilities, City Community Development, National Disability Institute, the Mayor's Fund to Advance New York City, Poses Family Foundation, as well as an advisory board of municipal offices, disability service providers, and financial empowerment service providers. and we want to thank them all very much. And I would now like to turn it over to Wanda Lopez to talk a little bit about New York City's Office of Financial Empowerment. And Wanda, I think you may be on mute.
Apologies. Am I in there now? Hello?
Perfect.
Yes, we can hear you.
Oh, great. I'm so sorry. The New York City Department of Consumer Affairs protects and enhances the daily economic lives of New Yorkers to create thriving communities. Here at the Department of Consumer Affairs, we license more than 81,000 businesses in over 50 industries and enforce consumer protection, licensing, and workplace laws, ensuring truth in advertising and that New Yorkers are able to take paid leave for sick time to care for themselves or their loved ones. Within the Department of Consumer Affairs, we do have the Office of Financial Empowerment that has been providing one-on-one financial counseling since 2008 in over 20 financial empowerment centers citywide, also providing free tax prep services in over 200 sites. We've helped 500,000 New Yorkers file taxes, which translates to $700 million in tax refunds and saved fees. So we're really excited to be a part of the Empowered NYC initiative. And with that, I'm going to turn it over to my colleague, Martha Jackson at the Mayor's Office.
Hi, good afternoon, everybody, and thank you for joining. For those of you not familiar with the New York City Mayor's Office for People with Disabilities, we have been in existence since the 1970s. Our focus is to make sure that New Yorkers with disabilities can lead happy, healthy, and productive lives. We work to improve services and programs for over 900,000 New Yorkers who self-identify as being a person with a disability. We are very focused on a number of pillars, including NYC at Work, which connects people with disabilities to meaningful living wage jobs across the 5 boroughs. The focus of our office, transportation, education, access to all things, health, especially health for accessible health for women, housing, affordable and accessible housing. The center of it all is, of course, employment. And because of that, we joined with our partners at City Community Development and the Office of Financial Empowerment to create Financial Security, which is now Empowered NYC. NYC at Work, as I mentioned before, is the first public-private partnership for employment for New Yorkers with disabilities. This has been designed as a business-led, business-driven initiative. We have close to 100 businesses who are taking the lead in this. It is, in fact, a supply and demand driven model, a collaboration among providers, businesses in the high-growth sectors, in vocational rehabilitation, schools and colleges, and New York City government.
And Frances.
And I'll turn this over to Frances.
Great. Thank you so much, Martha. It's great to be with all of you on this Empowered NYC webinar. My name is Frances Liu, and I'm here with City Community Development. We lead City's commitment to advancing financial inclusion. And we do this by partnering with leading nonprofits, with municipalities, and with community leaders. And together, we work to develop new programs and services and initiatives that ultimately strengthen economic opportunity for all. We are really thrilled to be a partner and supporter of Empowered NYC. This initiative builds on years of work we've done with the Department of Consumer Affairs Office of Financial Empowerment to strengthen and support financial counseling services and financial empowerment services for all New Yorkers. And this initiative is truly collaboratively co-developed. We are all committed to strengthening financial inclusion of people with disabilities, and these Empowered NYC webinars are a core component of this initiative. So very glad to be working with our excellent partners at the Office of Financial Empowerment, the Mayor's Office for People with Disabilities, the National Disability Institute, the Mayor's Fund, and others to bring Empowered NYC to life and to bring you today's webinar. So with that, I'll turn it back over to Nancy.
Thanks so much, Frances, and thank you very much, Wanda and Martha, as well. So I am so happy to introduce today's presenter to you all, or possibly reintroduce if you were on last month's webinar. Marlene Uliski, she is a manager of financial empowerment at National Disability Institute. I have been lucky enough to know her for, I'm going to say close to 20 years now, and she worked for the Social Security Administration for over 35 years. So thank you, Marlene, for being here. And with that, Marlene, I will turn it over to you.
Okay, thanks, Nancy. And I'm so happy to be here again this month to present some valuable information. Today we'll be talking a little about Social Security and SSI and some of the work incentives that folks with disabilities can use to become financially empowered. But before we do that, I wanted to talk just a minute about the National Disability Institute. The National Disability Institute is a national nonprofit organization dedicated to building a better economic future for people with disabilities. We're the first national organization committed exclusively to championing economic empowerment, financial education, asset development, and financial stability for all persons with disabilities. NDI affects change through public education, policy development, training, technical assistance, and innovative initiatives. So today's objectives, there's 5 objectives. What I plan to do is provide you with a greater understanding of the Supplemental Security Income Benefits Program. We'll talk about, about 5 work incentives, how to apply them while reducing the earnings that Social Security counts. We'll learn how to keep Medicaid while working under a special work incentive called 1619B. And if you were on last month's webinar, you'll probably recall we discussed how to keep Medicare for folks receiving SSI benefits. So these are really powerful work incentives. What we would like to do is change the focus of benefit limits to financial stability through employment. At the end of the webinar, Nancy will review some of the resources you can go to for some of the help that you need. Now, last month when we had our SSI webinar, we talked about benefits and how working and using those work incentives could increase the financial stability of persons with disabilities. And that webinar was real helpful to many participants, but we learned a little bit from it. And a couple of the things we learned were there were about 95% of the participants who said that they agreed or strongly agreed that our webinar gave them the information they needed, and they actually found some of the information so helpful that they learned how to apply some of the information. And we were really, really thrilled that that occurred but we would like that to be 100%. And about 90% of the participants said that either a little or most of the information was new. And we were really thrilled about that. We were happy to see that we provided information that folks out there needed but did not have. But then there was something we learned, a little bit of feedback we received, and we made a couple of changes. And some of that feedback was, for the returning participants, they wanted more examples and more questions and answers. So what you'll see with this webinar is we tried to incorporate what it was that you all wanted. You wanted more examples. You wanted a little more time at the end for questions and answers. So hopefully we're going to deliver what it was that you told us you needed. So let's start with SSI. So what is SSI? And we know that SSI is Supplemental Security Income Benefits. It's a needs-based benefit. Sometimes you'll hear it referred to as being means-tested, and it's meant to provide food and shelter for persons with limited means. Now, it's paid not only to individuals with a disability, but it's also paid to individuals. Oh, let me back up on that. Whoop. Sorry about that. It's paid also to individuals who are aged, and by aged I mean those who are over the age of 65. And it's a benefit. It's paid to disabled adults or children, and you'll remember from the last webinar, SSDI benefits was paid to adults, but SSI can be paid to adults or children, and children are defined as those under the age of 18, but they must have limited income and limited resources. It's funded by general tax revenues, so that means that everyone's tax dollars funds the SSI program, and in New York State and in most states, SSI recipients are also eligible for Medicaid. So what is the maximum amount paid? The maximum amount paid under SSI for a single individual is $750, or it's $1,125 for a couple who are both disabled, and the amount received can depend upon several factors. It could be affected by other income which is received. It could be affected by deeming. You'll hear that term. Deeming means that Social Security considers some of the income or the resources, either of a parent, as being available to a child, or the income or the resources of a spouse being available to the other spouse. That's what deeming is. So the payment could be affected by that, and it also could be affected by living arrangements. Some states supplement supplemental security income, and in New York State, the state pays a supplement which can be as high as $87, and all states do not pay that supplement. Here where I'm at in Florida, we don't pay a state supplement. Once again, that state supplement is affected by many factors. Again, it could be affected by income, it could be affected by living arrangements, it could even be affected by the county of residence. So to be eligible for supplemental security income, an individual must meet technical factors or rules which aren't related to disability or blindness before the disability or blindness is even considered by Social Security. And again, you see that an individual has to have limited income to qualify. That's under $750 a month. And limited resources, that's $2,000 for an individual, or it's $3,000 for a couple. If it's a child under age 18, mom and dad's income along with their resources, even if they're not receiving supplemental security income, may be deemed to the child, or that means it's assumed to be available to be used for the welfare of that child. And as a result, the child may or may not qualify for a benefit until they turn age 18, when that child becomes an adult and the parent's income and their resources are no longer considered. That's why sometimes you'll see that sometimes a child under age 18 does not qualify for SSI despite their disability, but suddenly when they do turn age 18, they reapply or apply and they become eligible as an adult. Now, if the individual does meet the income and the resource rules, then they have to meet the definition of disability. And you'll see there's a different definition of disability for a child, there's a different definition for an adult, and each are based upon a different listing of impairments in the Code of Federal Regulations. And I might add, too, that there's a different definition of disability for an individual who's blind under the SSI rules, because they don't have to meet a duration requirement. That's not a factor. There's some other additional technical requirements like U.S. citizenship or certain categories of aliens, along with some other rules. But with this presentation, we're going to focus more on individuals who are already on the disability rolls. We're going to focus on adults and on working, and this presentation actually is not meant to provide training on the rules for becoming eligible for a benefit. It's actually more or less to provide you with information on how someone can become financially empowered by working and by using the Social Security work incentive. Now, let's briefly look at some examples of some income which is not counted in the Supplemental Security Income Benefits Program. And you'll see on your screen a variety of items: value of food stamps, housing subsidy, home energy assistance, and with many folks who do receive a supplemental security income benefit, they also receive a variety of other public benefits. So working can actually affect a variety of benefits. So with this presentation, we're focusing on how working and using specific work incentives affects the Social Security benefits. But I would encourage folks who are thinking about working, or encourage providers who are working with individuals who are thinking about working. I would encourage them to make referrals to the Office of Financial Empowerment pilot sites so that the individuals can get a full picture of how working affects all benefits and how they can become financially empowered through employment. And again, on this screen, you'll see some other types of income, which is counted food and shelter based on need provided by a nonprofit agency, income tax refunds, including the earned income tax credit, or deposits into an ABLE account. And I think next month you all are, or in the following months, you're going to be having another webinar, and it will be involving ABLE. So we're coming to a poll question now. And our first poll question is, if you're a single individual who receives supplemental security income, can you have a balance of $95,000 in an ABLE account and continue to receive a monthly SSI payment? Could you please answer yes or no, and then we'll go over our results. And we'll wait just a minute or so. We'll see the results are coming in. And Shahida, are there a lot of responses so far?
We have about half of the participants on today's webinar who have answered. If you don't know where to locate it, it is currently on the right side of your screen. Please just tap either yes or no for this particular question. About 47 of us are left to answer.
Okay. Okay, and in the interest of time, can we talk about some of the results? So
sure.
What are the results?
Sure, so the results are 51 of you indicated yes, and 24 indicated no.
Okay. And with that question, the 54% who answered yes are correct. You actually can have a balance of $95,000 in an ABLE account and continue to receive your monthly SSI payments. And actually, assuming that you meet all of the other factors of eligibility, you can actually have up to $100,000 in that account, and it actually is not counted as a resource for supplemental security income benefits. So that's really, really a good tool that many folks who are working can use to save money for some of their disability-related expenses for the future. So that leads into some of the resources actually which are not counted, and you'll see on your screen some of the resources are a primary residence. It's one vehicle used for transportation. It could be an SSA-approved special needs trust or a pool trust. It could be ABLE accounts up to $100,000. It could be resources protected under a PASS, medical devices and adaptive equipment, or income tax refunds, including the earned income tax credit for up to 12 months after receipt. And with this slide, and in particular with the earned income tax credit, it used to be exempt for only up to 9 months. And I'm just throwing that out there just so that you know, even though sometimes when you think that you know the rules or you've heard the rules, they're subject to change. So it's always important to check with the Office of Financial Empowerment, with the financial counselor there, to see what the current rules are. And earned income tax credit, that could be income in the month received. It is not counted as income in the month received, but when it's saved, it's excluded up to 12 months. Now, when we look at the special needs trust or a pool trust, that can be counted as income, unearned income, when money is taken out of that account. But when it's in the special needs trust or the pool trust, and it's SSA approved, it's not counted. But remember, there's a big difference between income and resources. And I'll give you a little tip here. If you do have a special needs trust or a pool trust, that actually can fund or contribute to an ABLE account. So I encourage you to participate in the webinar on ABLE, because I think you'll be learning a lot of great tips on becoming financially empowered, or tips that you could pass on to some of your clients with regards to some of these income and resource-related rules. Now let's talk about Medicaid for a moment. Now once you're determined to be eligible for supplemental security income benefits, in New York, you receive state-administered Medicaid, and that starts immediately. And it's like that in most states, but not in all states. And Medicaid, as we know, is a federal and it's a state medical insurance program. Now, let's go on to some of the supplemental security income work incentives. And work incentives, like we said last month, they're special rules that Social Security has in place, and it makes it possible for individuals to receive SSI to work and still receive their monthly payments and their Medicaid. Now, the work incentives are there to support a beneficiary's efforts to become self-sufficient through working, or to even supplement their benefits through working. And it's probably the best way I can think of to begin a journey to financial empowerment. When you're continuing to participate in the trainings and the webinars, you'll see that there are so many other steps too that you can take to improve your financial well-being and become financially empowered. And to begin becoming financially empowered, it's always recommended, though, that a beneficiary contact the Financial Empowerment Center, one of the pilot sites, even before they begin to work. And I'm saying this for a lot of reasons. It's always crucial that a trained professional look at benefits and the type of benefit received and see if there's anything that the beneficiary needs to consider before taking that first big step. Things like what type of a medical review diary does that person have? Will it cause a medical review to be generated if they work? Is that person in a 5-month waiting period if they're receiving SSI benefits? Have they completed an EPE? Are they in an initial reinstatement period? There's a lot of questions that need to be answered. So it's really, really important that an individual with a disability check with a Financial Empowerment Center and talk to a financial counselor to get the correct information and the accurate information that they do need. So how can work incentives help? Now, the work incentives, they can help an individual with a disability to transition to work and to keep more of their income or to maintain their Medicaid. And with more income, an individual can pay for better medical care or work-related expenses. They can save money, build assets, live in a better or a safer neighborhood. They can meet new people or become more independent. It's all about living the type of life that they choose to work and not limiting their choices in life. It's all about learning about work incentives, and I think the choice is there, and it's about planning for the future. Now, an individual can actually work at whatever level they choose is best. They can work part-time, they could work full-time. But with that being said, I just wanted to mention something that I often hear individuals say that I can only work at the part-time level, or Social Security will cut off my benefits. And I think it's really important to clarify that Social Security does not look at whether a person is working part-time or whether they're working full-time. They really don't care if they're working part-time or they're full-time when they're employed. But they do look at their earnings, the amount of their earnings. Sometimes I hear providers say, yeah, it's okay to work part-time, but it's not, full-time isn't an option. And that's so misleading, and it's really holding individuals back because many are capable of working more hours, and I think it would benefit their financial situation. When there's questions related to the level of work or to earnings, particularly when a beneficiary receives a variety of public benefits, like many SSI recipients receive, it's always crucial, again, to talk to a trained professional. I'll give you one quick example. A provider may tell an SSDI beneficiary that they can work at whatever level they choose for 9 months and it won't affect their benefits. But they may not consider the other public benefits that they receive. And if this particular individual, let's say they're on a home and community-based services waiver, there are different income limits under that program. They're different than the SSDI limits under that program, and it actually can affect the waiver. And we all know that folks who receive waiver services, many of those services are very critical for that person. There's some examples shown on your screen of some of the work incentives we'll talk about. They're all very powerful work incentives, and you'll see the 5 listed that we'll talk about today. The student earned income exclusion, the earned income exclusion, the plan to achieve self-support, Section 1619B, or continued Medicaid while working, and expedited reinstatement. So let's start out. We're going to talk first about the student earned income exclusion. And the student earned income exclusion, it can only be used by an SSI recipient. If someone's receiving SSDI or DAC benefits or disabled widows benefits, they can't use it. The SSI recipient has to be under the age of 22 and regularly attending school. And Social Security does have some rules on what is or what constitutes regularly attending school, but all you need to know now is that it does not mean that that individual has to be in school full-time, and it doesn't mean that individual has to even be in a formal classroom setting. If the individual is under the age of 22, they're regularly attending school and they're working, Social Security will not count up all of their earnings when they determine what the SSI payment amount will be. And you'll see on your screen up to $1,820 of earnings each month can be excluded under this work incentive, or up to $7,350 of earnings per year. That's a lot. So we're going to see in the next slide an example of it. So we have Juan, and Juan is 19. He's an individual with a disability. He receives SSI. He graduated from high school, and he began attending CUNY. And while he's attending school, he accepted a job working 5 days a week, 4 hours a day at $15 an hour. We use the formula Social Security uses when they don't have pay stubs, and we see that he's earning $1,299 a month. So we look and we see his gross earnings are $1,299. The student earned income exclusion allows him to exclude up to $1,820 a month. So he has 0 in countable earnings. His SSI payment is $750 a month. His earnings are $1,299, and his total income is $2,049. His SSI payment is not reduced because he's using the student earned income exclusion. It's a really, really powerful work incentive. But what happens to the SSI payment if we have a working SSI recipient and they no longer qualify for the student earned income exclusion? Maybe they're over the age of 22, or maybe we have someone who's not attending school. You see on this slide that Social Security applies a general $20 general exclusion and a $65 earned income exclusion. What that means is they don't count the first $20 of earnings. They don't count the next $65 of earnings when they determine what the payment amount will be. After they subtract that total of $85, they divide the earnings by half, and that is the amount which reduces the SSI payment. And we'll see an example on this next slide. On the next slide, we see Juan again. He's 22, still attending school. He's doing well. He's doing so well that his employer gave him a raise. He works 5 days a week, 4 hours a day, $16 an hour. He makes $1,385.60 a month. Social Security from those earnings, they subtract the $20 general exclusion, they subtract a $65 earned income exclusion, they divide in half, and that ends up being $650.30 in countable earnings. That's the amount which reduces his $750 SSI check, and what remains is $99.70. That's his new SSI payment amount. When you add that to his earnings, he is still in a better position by working. He has $1,485.30 in total income. Now, so the way it works is when one is reporting his income, Social Security puts his earnings into the computer, and the computer automatically applies these exclusions. So one doesn't really even have to ask them to apply this. It's just all automatic. So now we're ready for the second poll. And with the second poll, an SSI recipient, it's stating that an SSI recipient must receive at least $1 in SSI each month to keep their Medicaid coverage. Is that true or that's false? They have to have at least $1 in SSI to keep their Medicaid. True or false? Okay, and we'll just wait a moment. Okay, Shahita, do we have a lot of responses?
Yes, we have about 50% who have participated. And I'm just going to let everyone put their votes in and then end the poll, and then afterwards the actual figures will show.
Okay. Okay, and
okay, so it closed down. I'm going to close the poll now.
Okay. Okay, and can you tell us the results, Shahida?
So we have 24 people who indicated true and 39 who indicated false. Poll results will be showing shortly.
Okay, and the answer to that is no. And you may hear that this is a fact, and it actually is a myth, that you must have at least $1 in SSI for Medicaid to continue, but it truly is absolutely false. I think this may have stemmed from the fact that when an individual applies for supplemental security income benefits, they have to be eligible for a cash payment, at least $1 cash payment for at least 1 month before qualifying for 1619B. So after an SSI recipient goes to work, their Medicaid can continue if earnings either alone or in combination with other income, it's too high for an SSI payment. Now to qualify though, an SSI recipient has to meet all of the other rules of eligibility. If SSI benefits, if they stop because someone has excess resources or if they stop for any reason other than earnings, their benefits, their Medicaid can actually stop. So to qualify for 1619B, an individual, an SSI recipient, has to meet the 5 rules shown on this slide. And those rules are they have to have been eligible for an SSI cash benefit for at least 1 month before becoming eligible for 1619B, and we talked about that. They must still have a disability, and what that means is they did not have a medical continuing disability review that found their disability ceased. They must meet the SSI eligibility requirements except for their earnings. They must need continued Medicaid to work, and they must earn under the state threshold level or have gross earned income that's insufficient to replace SSI, Medicaid, and any other publicly funded Medicaid benefit. In New York State, the state threshold level is $45,812, and that amount varies from state to state. If someone, though, or however, has earnings above that amount, But they can actually apply for an individualized threshold with Social Security if, again, their earnings cannot replace their SSI, their Medicaid, or any publicly funded attendant care benefits. Now on this slide, we have an example of the calculation with earnings in 1619B. And on it, we see that one is now 23. He graduated. His employer was pleased with his progress and his productivity. He increased his hours. He's now working 30 hours a week, and he's earning $16 per hour. Now, he really wants to pay down his student debt by working more hours and earning more money, but he's afraid. He's afraid to lose his SSI cash payment, and he's afraid to lose his Medicaid completely. So with the amount of hours he's working and his hourly rate, his earnings are $2,078.40 a month. Social Security subtracts a general exclusion of $20, a $65 earned income exclusion. They divide in half, and his countable earned income is $996.70. That's far more than the $750 SSI payment, so that means his SSI payment is zero. But his Medicaid continues so long as he meets the rules on the prior slide, and it continues automatically. What Social Security does is they enter the information into their computer. Their computer system transmits a code to the state saying Medicaid continues, and the Medicaid does continue. Now, the next work incentive we'll talk about is the Plan to Achieve Self-Support, or PASS, and it's work incentive for individuals either who are receiving, as I said, SSI, or they can become eligible for it by setting aside some of their earnings, some of their unearned income, or by setting resources for a set period of time for items, to use for items or services needed to achieve a work goal. And their work goal must specify an individual job when complete, which either decreases, for folks receiving SSI, it decreases the amount of SSI they receive, or if it's someone who receives SSDI also, it must totally eliminate that benefit if they achieve their work goal. Now, work goals could be something like maybe someone has a work goal, they want to become a registered nurse. So their expenses may include paying for a portion of their education not covered by grants or not covered by other programs. Maybe they have to purchase books or pay for transportation to and from school. So that may be someone who may benefit from a PASS. It could be something like continuing to work even in a current job. And you don't hear of that very often, but it is possible to have a PASS for something like that. Perhaps you have an individual, there's someone with an intellectual developmental disability, and maybe they're working as an assembler or doing data entry work, and they have a job coach, and they want to work more hours with less support, but they need someone to pay for that job coach. They are paid for it for a limited period of time, and let's assume they're not on a waiver which can pay for it. So they need somehow to fund that job coach, and a PASS may be the answer for someone like that. A work goal cannot be something like, I want to get a degree, I want to purchase a vehicle, I want to buy a computer, but it has to be a specific goal, a registered nurse, an accountant, a plumber, a maintenance worker, or something like that. Again, for SSI recipients, if they achieve their work goal, the work goal must, the amount of money they receive by achieving the work goal, it must decrease the amount of SSI benefits they receive. And for those receiving SSDI benefits, the goal must be at the SGA level or higher so that it would totally eliminate that SSDI benefit. When Social Security actually figures that SSI payment, they won't be counting the income or the resources that the beneficiary is saving and setting aside for those items or expenses that they have under their PASS. So that means either an SSI payment or a higher SSI payment. On this slide, you'll see some examples of PASS expenses. education, training, job coaching. It could be attendant care services, could be child care, transportation, or perhaps it may be equipment, tools, or uniforms for a job. And on this slide, you'll see an example of how PASS works. And in our example, we have Tim, and Tim needs to buy tools for a plumbing apprenticeship program. He works part-time, 10 hours a week. His employer pays for his apprenticeship schooling, but Tim is setting aside $357.50 a month in his PASS for tools and transportation to get to and from his job. So in the first column, you'll see how working affects Tim's benefits without a PASS. He's earning $800 a month. After Social Security does their calculations, the countable income is $357.50, and that reduces his SSI payment to $392.50. In that second column, you'll see how using the PASS to save for his expenses, for his tools and his transportation affect his PASS. Notice that he's still earning the same amount. He's still earning $800 a month, and he's still saving that same amount, $357.50. So when Social Security deducts his PASS savings from the income they count, his countable earnings or his countable income is zero, which means that his work doesn't receive his SSI benefit due to the PASS. On the bottom line, you'll see the comparison of the total income when he uses a PASS and when he's not using a PASS. So I think that you can see that it's very beneficial for those folks actually who can use a PASS to achieve their work goal when they have expenses for items or services needed to achieve that goal. The last work incentive we'll talk about today is expedited reinstatement, and expedited reinstatement actually is a safety net for individuals who work their way off benefits and they're terminated, but for one reason or another, they have to return to the disability roll. It allows that beneficiary, and that can be an SSDI beneficiary or an SSI beneficiary, to again begin receiving benefits if they cannot continue to work or if they had to reduce their earnings to under a substantial gainful activity level. We talked about SGA last month, and we said that is $1,180 in countable earnings. To qualify for expedited reinstatement, an individual has to apply for that within 5 years of the date they were terminated, and they have to have either the same or a related disability. Their Medicare and their Medicaid could start up immediately, and provisional payments start up immediately for up to 6 months while Social Security is processing their case. And I just want to mention one thing on this slide, that there's a big difference between termination and suspension of benefits. Payments have to be terminated. When someone is in 16B status, their actual payment is suspended, it's not terminated. When someone is in an extended period of eligibility, they're working above the substantial gainful activity level, their benefits are actually suspended, they're not terminated, and they could be reinstated without using expedited reinstatement. This is just the work incentive for folks who are terminated because they were working at such a high level that they work their way off benefits. Now, how and when to report earnings? It's important that SSI beneficiaries report monthly during the first 6 days of the month. The SSI payments have to be adjusted, and they could go up or down based upon the earnings Social Security counts. So there's a variety of ways that SSI recipients can report to Social Security, and a couple of them are shown on your screen. An SSI recipient could set up a My Social Security account and use the online wage reporting application. But to do that, they must either not be starting a new job, or Social Security, they must have reported their earnings at least once to Social Security so that the employer identification number is entered in the Social Security system. They also can use a mobile wage reporting application from a smartphone, or they could use an SSI telephone wage reporting system. Or the last way is they could either call, fax, or write to the local Social Security office and provide their pay stubs. What to report? In the first webinar on SSDI, again, we discussed about communicating and keeping in constant communication with Social Security. And when someone does begin working, they need to report the name of their employer, the number of hours per week they're working, and their hourly wage, and any changes to that, if they get a raise, if they get a promotion, the date they started their job, the date they stopped working, their Social Security number, and they need to provide their pay stubs on which they've noted their Social Security number and their name. Oftentimes, pay stubs do not include the Social Security number, and Social Security sometimes finds it difficult to find a particular person in the computer system, particularly if your name is very common. Some reporting tips, regardless of whatever method is chosen. One tip is to sign up online to receive monthly reminders, either text message reminders or email reminders to report. If both SSI and SSDI benefits are received, it's always helpful to make 2 copies and provide 1 copy if you are reporting via fax in person to the SSI unit and to the SSDI unit. To always keep a copy of anything you give or you receive from Social Security for your records, and always maintain a receipt. Under the law, Social Security is required to provide a receipt no matter how work is reported, and that's under the Social Security Protection Act, and that may be used later should an overpayment actually occur. SSI work incentives and financial stability. You can use more than 1 work incentive at the same time. Work incentives allow an SSI recipient to keep more of their earnings and to become financially empowered. We learned that 1619B allows ongoing access to Medicaid while working. And we also learned that it's possible to immediately get benefits back if they're lost due to employment through the work incentive Expedited Reinstatement. So with that, I think, Nancy, I'm going to turn it back over to you.
Thank you so much, Marlene. What absolutely wonderful information. And I have had the pleasure not only of listening to you, but also kind of looking at some of the questions and answers that have been coming in and out. And I do have some questions for you, but I will give your throat a break, and I will go through a few slides first. And that first is action items. So we're very happy that we had close to 150 folks participating today. Please keep joining us each month to build your knowledge base and your level of comfort regarding financial empowerment. And please use the tools that you learn about how to verify benefits, because as I think Marlene showed pretty critically between last month and this month, the differences between benefits, SSI and SSDI are huge, and it's important to know what benefits somebody's receiving. And another action item is to remember that we are going to be offering free and confidential financial counseling services. So please get ready to refer your customers to this new project that will be coming this fall. And also, please let us know if you would like to join our referral network. And you can join that network by contacting Wanda Lopez, W.A. Lopez at dca.nyc.gov. It's also on your screen. And we also have some resources for you before we, and then some contacts, and then we'll do fit in a few more questions. So some great resources. One is the Social Security Administration. They have a wealth of information on their website, and then beneficiaries can also call the toll-free number and get information to help them out as well. Also, New York Protection and Advocacy for Beneficiaries of Social Security, which is also the PABS program. So anybody who is having difficulty with the Social Security Administration, they're a great advocacy organization. Also, work incentives planning and assistance. Hostos at CUNY Community College, they offer work incentives planning and assistance. We will also be providing it through the pilot project. So we're happy to be able to give you information about people who are interested in going back to work and all the great benefits that Social Security has to offer. And one of those is the Ticket to Work program, and you can go to choosework.org for that. And then lastly, Marlene mentioned PASS plans. And Cornell University actually has a great tool, and it's passonline.org, very easy, but it gives you sample passes, and it gives you an opportunity to actually write out your pass and save it on that website as well. So really some great information there. Moving on to contacts. So we've got myself, Nancy Bhutto, and I know we saw a couple questions in the chat box that were pretty in-depth and pretty complicated. Feel free to send your questions to me, and I will make sure that they get answered. We already told you the contact information for Wanda Lopez, also Krista Rivera with the Office for Financial Empowerment, and of course Abby Meyerhoff with the Mayor's Office. So we are all here to answer any questions that you may have about our specific program or about the pilot project. So questions. Marlene, there is a question that I think would be good for you to answer that somebody had, and that was, is there an application process for 1619B? How does one get 1619B?
That's really a great question, and no, there is no application to apply for 1619B. What's really important to trigger 1619B is for an SSI recipient to regularly report their earnings to the SSI program. SSI will in turn input that data into their computer system, and that is unless the person is self-reporting using My Social Security or one of the other means. Once everything is posted to their record in the Social Security computer system, there's a data exchange, and Social Security sends that information to the state agency which administers the Medicaid program. So it shares that data, the code is transmitted, and 1619B, the Medicaid continues. So there actually is no application.
Great, thank you so much, Marlene. We also have another question which I'll be able to answer, and that is, where can we access the resources we just mentioned? So I will let everybody know to go to our website, and you will be able to click on all of our previous webinars and get all of the information, including the resources that we mentioned today. Today's webinar should be up on the website in roughly a week and a half to 2 weeks. And moving on to our final slide, this addresses somebody else's question. Join us for our next training. Somebody had a question about ABLE accounts, and we were able to answer that in chat, but I also wanted to let everyone know that next month, Tuesday, October 9th at 1 p.m., we will be having our next webinar on New York ABLE, financial empowerment, and ABLE accounts. So you will be able to learn much more about that. The registration link is there for you to join us. And once this survey ends, once this PowerPoint ends, a survey is going to pop up. We really hope that you enjoyed the examples that we gave today. That was from your feedback from our last webinar. So we are definitely using your feedback to help us develop this training series to meet your needs. So please take a moment to answer our survey. Thank you all very much for your time today, and we look forward to talking with you next month. Bye-bye.